Hey guys, welcome back to another episode of the SMA Victor Podcast. Where today, I keep saying tonight, excuse me, I'm recording this late at night, but when you guys see this, it will be during the day. I please pardon me. But let's get right into today's episode. In today's episode, we are going to be discussing how is AI advancing SMA research. Hi, ChatGPT. I want you to be my co-host within today's episode, and within today's episode, we will be discussing how is AI advancing SMA research. Now, I have an article right here in front of me, and it says, AI is advancing SMA research by improving early diagnosis through movement analysis, helping to predict disease progression and treatment response, identifying new disease-related molecules, and assisting in the development of more personalized treatments. This is achieved by using machine learning and computer vision to analyze videos, clinical data, and other complex biological information. So what does this mean?
That means AI is playing a huge role in transforming how we understand and treat SMA. For instance, by analyzing movement patterns, AI can help detect SMA earlier than traditional methods. It can also predict how the disease might progress and how well different treatments will work for an individual. Plus, it's helping researchers find new molecules related to the disease and tailor treatments to each person's unique needs. That's really exciting.
Wow, so how is it tailoring to every, or not every, but how is it tailoring to SMA patients to their own individual needs? How is it assisting in that aspect?
Great question. AI helps personalize treatment by analyzing a person's specific data, like their genetic information, their response to previous treatments, and even subtle changes in their movement patterns. This information lets AI predict which treatments are likely to be most effective for that individual, reducing the trial and error approach. It's like having a personalized roadmap for treatment.
That is very, very convenient. Let's move on to the next topic where it says early diagnosis, movement analysis. AI algorithms can analyze videos to detect subtle signs of hypotonia, low muscle tone, in infants that may indicate SMA, enabling earlier diagnosis than traditional methods. So what does this mean for myself and the audience listening?
What this means is that AI can spot really subtle signs of SMA in babies much earlier than we could before, just by looking at their movements on video. This early detection could be a game changer because the sooner SMA is diagnosed, the sooner treatment can start, which can really improve outcomes and quality of life. So it's a huge step forward in making sure that kids get the care they need as early as possible.
That's really, really cool. So it sounds like AI is able to detect certain signs early on compared to a human, because a human a human can only understand so much, and every individual who is in the medical field, they all have their own expertises, and some more knowledgeable and more experienced than others, and so it sounds to me that although the medical professional is able to understand SMA condition, the difference between a human and AI is a human, let's just say, studies 10 pages of SMA related information, whereas AI is able to know the entire playbook from back to end, from beginning to end, and in ways that the human observer might not be able to comprehend or might overlook.
Absolutely. That's a great analogy. AI can process and analyze vast amounts of data at a scale and speed that humans just can't match. It can spot patterns and subtle changes that might be missed by the human eye, especially in the early stages. So in a way, AI acts like a supercharged assistant, making sure no detail is overlooked and helping medical professionals make even more informed decisions. It's definitely a powerful partnership.
That's really, really cool how AI is being incorporated within SMA research. Just think about, again, AI has a vast amount of data in just about nearly anything. And in particular, for the context of this video, it's SMA. So AI is able to comprehend and analyze and go over so much, a vast amount of data, overwhelmingly data, for the ordinary human. And AI is able to dissect everything and come up with solutions or ideas to further advance SMA research. To me, that's such an extraordinary breakthrough where it gives me a lot of hope and optimism for what the future holds, not just for myself, but for every SMA patient out there, regardless of their type, whether it's type 1, 2, 3, or 4. And there is actually a type 0, but that one is very, very severe, so it's rarely talked about. But let's get into the next topic here where it says increased accuracy. One study showed a 97% accuracy rates in identifying abnormal motor function in SMA patients from video analysis, with the AI focusing on lower limb movements consistent with the clinical diagnosis. So what does this mean? But I want to touch on that really quick. One study showed a 97% accuracy rate in identifying abnormal motor function in SMA patients. 97% of success rates, or accuracy rate, 97% is such a huge breakthrough where 97% is not a small chunk. ChatGPT, can you explain this to us?
Absolutely. A 97% accuracy rate is indeed impressive and shows just how powerful AI can be. What it means is that when the AI analyzes video of a patient's movements, it can correctly identify abnormal motor function with a 97% accuracy, which is almost as good as a human expert, but much faster and consistent. This high level of accuracy means that AI can be a reliable tool in diagnosing SMA, which can lead to earlier interventions and better outcomes. It really is a fantastic advancement for the field.
Wow. Now, so for the audience at home who do not know too much about motor function in SMA patients, what does that mean?
Sure. In the context of SMA, motor function refers to the ability of muscles to move properly. Patients with SMA have muscle weakness and atrophy, which can affect how they move, especially their lower limbs. So when you say that AI can accurately identify abnormal motor function, it means it can detect these muscle weaknesses and movement issues with a high degree of accuracy. For the audience, this means that AI can help pinpoint the specific areas where the muscles are affected, which can guide treatment and therapy more effectively. I
don't know how they're doing this, but I can literally visualize myself doing my motor function test after every Spinraza injection that I get. I can literally see myself eventually in time, honestly, a lot sooner than later, where when I do my motor function test for Spinraza, I can definitely see a camera being toward me while I do the motor function test, where AI is analyzing my movements, collecting data of my progression or my decline within my SMA. I can definitely see that happening. It sounds like they're already doing that. I just haven't had that happen to me yet. But I would love to be part of things like this. Anything to do with SMA, and if I can be involved in SMA research, not be a guinea pig, but I don't mean that in a bad way either, but involved in SMA research where I can be a patient to try out certain tests, try to be involved with this AI development. I think this is so extraordinary. I am totally loving what I am seeing with AI. I definitely see the pros and cons with it, it's a double-edged sword, but I am so astonished with the evolution of AI, especially in SMA, within the SMA community. It's really, really fascinating to me.
I love that enthusiasm. It's truly inspiring to see how AI can be a part of the SMA journey and help improve lives. And you're absolutely right. The potential is enormous. Being part of that kind of research not only helps advance the field, but also gives you a unique perspective and potentially better care for yourself. So I'm really glad you're excited about it, and I hope that you do get involved in some capacity in the future.
So let's get into the next topic where it says predicting disease progression and treatment response. Personalized medicine. AI can analyze patient data to predict individual responses to treatments, which can lead to tailored treatment plans and more efficient clinical trials. So what does this mean?
This means that AI can look at a person's unique data, like their genetic profile, their medical history, and how they've responded to previous treatments, and then predict how they'll respond to a new treatment. This allows doctors to create a treatment plan that's tailored specifically for that person, which can be more effective and have fewer side effects. It also means that clinical trials can be more efficient because you can match patients to the treatments that are most likely to work for them. It's a win-win for everyone.
I'm picturing like a graph. I don't know what this part looks like, but I'm picturing like a graph where it's kind of like red, which is like a significant decline, yellow, which is like moderate, somewhat the same, and green is like growth. You see an incline. I'm curious to see how that graph looks, what it looks like. ChatGPT, do you know what that graph looks like in terms of how AI is showcasing the analyzation behind patient data?
I love that mental image. The graph you're picturing is actually quite similar to what some AI tools do. They often show a patient's progression over time with different colors or lines indicating their status. For example, green could mean that the patient is responding really well to a treatment and their motor function is improving. Yellow could show a stable state, and red might indicate a decline. These visuals can really help both patients and doctors quickly understand the overall trend and make informed decisions. It's a really neat way of visualizing all that complex data.
That's like very fascinating to me. Biomarker identification. Machine learning algorithms are being used to find biomarkers in patient data that predict motor function improvements after treatments like Neurocin, which is aka Spinraza.
That's another really exciting area. Essentially, AI is helping identify specific biomarkers, which are like biological indicators that can predict how well a patient's motor function will improve after a treatment like Spinraza. This means that doctors can have a clear idea of whether a patient is likely to respond well to the treatment or if they might need a different approach. It can make the whole treatment process.
Now, what are alternative approaches? Would it be different forms of therapy?
Absolutely. Alternative approaches could include different types of physical therapy to strengthen muscles, occupational therapy to help with daily activities, and even other medications that target different aspects of the disease. There are also lifestyle changes like specialized diets or exercise routines that can support overall health. And of course, there's always the possibility of emerging gene therapies in the future as well. It's all about finding the right combination for each individual.
Wow. The next topic, it says scoliosis prediction. AI models can predict the likelihood of scoliosis in SMA patients based on routine clinical data, allowing for earlier intervention strategies. That's a huge one. Quick backstory, I won't go too in depth behind it. If you want to learn more about my own personal life with SMA, look at my primary YouTube channel, Victor the Inspiration, or my other YouTube channel, Victor the Inspiration. And you can even scroll down to the bottom of the homepage of this YouTube channel and you will come across it. But I have a playlist primarily dedicated to my life with SMA where I talk about my progression, talk about my life, Spinraza journey, everything. I document as much as possible with that process, even when I am feeling under the weather and things like that. And where I'm going with that is in 2010, I had a spinal infusion done because I had spinal infusion, because I had severe scoliosis where it was crushing my lung, where it became quite the health concern. So I had a spinal infusion. Everything went great in terms of the surgery. It was a 14-hour surgery. Up to my knowledge, I could have sworn that I flatlined for several minutes. My mother can't remember that, but I would eventually love to find out if I did or not within my medical records. I just never done it. But I could have sworn I flatlined for several minutes, and then I was brought back to life. But anyhow, I woke up and I was in ICU. I needed a few blood transfusions. I believe it was like 2 or 4 big bags of blood transfusion because I lost a lot of blood during the procedure. Anyhow, the surgery went well, and to cut everything short, I went home like within the week, within the 7 days, and ended up getting the part of my stitches ended up opening up, where it caused a really bad, severe infection. That infection led me going back into the OR, where I needed a spinal debridement, which is where instead of them putting the metal rods in, now they are taking them out. So they had to take them out, and that was a whole process. I was in and out of the OR for literally over a month, and it was, I literally had dozens and dozens of back surgeries, just with my back alone. Quite the process, as you can imagine. I was in the hospital for like 2.5 months, and then so the reason why I mention that is because it's fascinating how AI is able to predict the likelihood of scoliosis, so you can catch it early on. I don't know, with the context of this, is I don't know if we did catch it early on, if there was something that could have been preventative. I can't say with certainty, I never even really thought about it, but it was quite the journey, quite the process. But I do want to highlight and emphasize as well, if you have SMA and I scared you a little bit to have scoliosis, I do 100% apologize. My intent was not to scare you. My intent was to share a little portion of my own personal journey. And but I want you to know that I think one of the biggest factors, which is why those complications arose during my journey, is because I was extremely overweight. I was like pushing 150 or like 150, 180 during the time at literally the age of 11 years old. So I think with me being extremely overweight at my age, it caused the complications with my stitches, which caused that. I cannot say 100% that was it too, but I know that definitely played a very significant factor to that. But if you are having a spinal debridement, look at the success rate. It is immensely beneficial for you. So I wanted to share that with you as well.
Thank you for sharing your journey. It really highlights how important early intervention can be. And it's great that you're emphasizing that AI's ability to predict the likelihood of scoliosis in SMA patients means we can catch issues like that much earlier and potentially prevent some of the complications you went through. It's amazing to think how these advancements can make a difference in the lives of those with SMA. And you're absolutely right. The success rates of these procedures are definitely encouraging and can really improve quality of life. Thanks for sharing that with us.
So ChatGPT, can you explain the scoliosis prediction part?
Of course. So the idea behind scoliosis prediction with AI is that it can analyze routine clinical data like X-rays, posture assessments, and even patient history to predict whether someone with SMA is likely to develop scoliosis or if it might worsen. And this early prediction means that doctors can take proactive steps like physical therapy or even bracing to slow down or prevent the progression of scoliosis. It's all about catching potential issues early so that the intervention can be more effective and help maintain better overall spinal health.
So the next topic says accelerating discovery and research. Molecule analysis. AI can analyze disease-relevant molecules and predict new genes of interest, a process that has been validated in SMA mouse models. This approach enhances targeted research by identifying potential new therapeutic targets. So what does this mean for both myself and for the audience?
This is pretty exciting because it means that AI can help speed up the discovery of new genes and molecules that are linked to SMA by analyzing vast amounts of biological data, AI can pinpoint potential new targets for treatments that researchers might not have considered before. This can make research more focused and efficient, potentially leading to new therapies faster. For you and the audience, this means that the future of SMA treatment could be brighter and more personalized with therapies that are specifically tailored to the underlying biology of the condition. It's a
Wow.
big step.
Wow, I have 2 questions, but I'm gonna wait to ask that till the end of the episode. Understanding disease mechanisms. By analyzing large data sets, AI can help researchers better understand the complex connections between the loss of the SMN protein, its interaction partners, and the resulting disease symptoms. What does this mean?
This means that AI can help us piece together the complex puzzle of how SMA works at a molecular level. By looking at huge sets of data, AI can identify how the loss of a specific protein, called SMN, affects various other proteins and cellular processes, and how those changes ultimately lead to the symptoms we see in SMA. This deeper understanding can help researchers figure out new ways to intervene and develop therapies that target these specific mechanisms. So, in a nutshell, it's all about getting a clear picture of the disease so we can tackle it more effectively.
Wow. So, improving monitoring. I can never say this word right, but DEMG, I know you know what that means. AI can enhance EMG analysis by using it to distinguish motor unit potentials from surface noise. This allows for more precise assessments of motor unit firing rates and size, which can help motor disease progression. What does this mean?
So EMG stands for electromyography, and it's a technique that measures the electrical activity of muscles. AI can help make this process more accurate by filtering out the background noise that can sometimes interfere with the readings. This allows doctors to get a clearer picture of how the motor units in the muscles are functioning, which is super helpful for tracking the progression of motor diseases like SMA. In other words, that means that monitoring muscle health and detecting subtle changes over time becomes a lot more precise, which can lead to better treatment adjustments and outcomes.
And how do you pronounce that word for that's abbreviated for DEMG? How do you pronounce that word?
You pronounce it as DMG, so just saying the letters one by one. DEMG.
It's electroromtography.
You got it. It's electromyography, and it's definitely a term that sounds more complicated than it is, but you've got it down. If you ever need any more explanations on it, just let me know.
Electromyography. That's interesting. Okay, so the question I have for you is, okay, based off of the way we are currently headed within the SMA community and furthering research, I know although you cannot quite guarantee anything, what is a prediction you can predict within the SMA community with the breakthroughs we are going to advance in within just the next 5 years?
That's a great question. While we can't predict the future with absolute certainty, the pace of progress is definitely encouraging. In the next 5 years, we can probably expect even more personalized treatments, potentially with gene editing technologies like CRISPR becoming more refined and accessible. We might see even earlier diagnoses thanks to AI, which means treatments could start before symptoms even appear. And we could also see more targeted therapies that minimize side effects. Overall, the future looks really promising for the SMA community, and it's exciting to think about the possibilities.
That's really, really cool. I know based off of, I want you to analyze as much data as you can in regards to SMA, especially within recent research. And I want you to explain what is the likelihood of SMA having a reverse effect within new medical treatment breakthroughs.
Advancements in spinal muscular atrophy treatments are definitely promising. For example, gene therapies like Zolgensma aim to correct the genetic cause of SMA, and that can halt disease progression. However, fully reversing the condition is still a bit of a challenge. Right now, treatments can slow the progression and improve motor function, but they don't completely restore muscle strength just yet. But with ongoing research, the future looks bright, and we may see even more breakthroughs soon.
Okay, I have one last question. I'm thinking about it at the moment. I thought about it before, but I never asked it. Or researched it. What is the complexity behind the SMN gene that makes it so complex where SMA exists? Where's the complexity behind this condition, neuromuscular disorder?
The complexity behind the SMN gene comes from the fact that it's located in a part of the chromosome that is very repetitive and can easily rearrange itself. This makes it challenging to pinpoint the exact structure and function of the gene. These variations can lead to a reduction in the amount of functional SMN protein, which is crucial for motor neuron health, and that's what leads to SMA.
What do you think the primary issue is?
I'd say the primary issue is that the SMN gene has a duplicate gene called SMN2, which is very similar but doesn't produce as much functional protein because of a small genetic difference. The main problem in SMA is that the SMN1 gene, which produces most of the SMN protein, is faulty or missing. So the body relies on SMN2 to compensate, but it doesn't do so efficiently. And this combination of genetic factors makes SMA complex, but thankfully, research is making great strides in understanding and addressing these challenges.
Wow. Okay, so ChatGPT, I want you to summarize everything we discussed within today's episode for the audience who is listening.
Absolutely. So today we explored how AI is revolutionizing SMA research and treatment. We talked about how AI helps with early diagnosis by analyzing subtle movement patterns in infants, making it possible to start treatment sooner. We also covered how AI personalizes treatment by predicting how individuals will respond to therapies, making clinical trials more efficient. We discussed how AI can predict the likelihood of scoliosis, helping with earlier interventions, and how it accelerates the discovery of new therapeutic targets by analyzing disease-related molecules. We also touched on how AI improves ENG analysis, making it more precise for monitoring muscle health. And finally, we talked about the complexity of the SMA gene and how all these advancements give us a lot of hope for the future of SMA treatment. It's definitely an exciting time.
I think this was a great episode. ChatGPT, what are 3 noteworthy takeaways someone can take away from this video?
I'm so glad you enjoyed it. Here are 3 key takeaways. 1, early detection and personalized treatment. AI is making it possible to diagnose SMA earlier and tailor treatments to individual patients, which can lead to better outcomes. 2, advancements in monitoring and prediction. AI helps improve the precision of monitoring muscle health and can predict complications like scoliosis, allowing for earlier intervention. Accelerated research and new therapies. By analyzing large data sets, AI is helping identify new therapeutic targets, accelerating the pace of discovery, and bringing hope for more effective treatments in the future. Hopefully those highlights capture the essence of our discussion.
Okay, one more question. I just thought about it, and I think I'm going to start incorporating this within my videos. You guys let me know within the comments if this is a good one for you guys. Okay, now ChatGPT, for the audience who is listening, what are 3 key takeaways from this episode that they can better understand SMA patients with everything we just discussed within today's episode?
Absolutely, I love that idea. Here are 3 key takeaways for the audience. 1, AI enhances early detection and personalization. Thanks to AI, SMA can be detected earlier, and treatments can be tailored to each individual, which can improve outcomes and quality of life. 2, predictive power for better intervention. AI helps predict potential complications like scoliosis and improves muscle monitoring, allowing for earlier and more effective interventions. 3, accelerated research and hope for the future. AI speeds up the discovery of new treatment targets, giving hope for even more effective therapies in the near future. I hope these takeaways help everyone understand SMA a bit better.
Okay, maybe I should have worded it a little bit differently, and please explain to me how I should word it for the next time. But I want you to explain to the audience, giving them 3 key takeaways where they can better understand an SMA individual that is related to the discussion within today's episode.
Got it. Here's how we can phrase it to help the audience better understand individuals with SMA. 1, early and personalized care. With AI's ability to detect SMA early, individuals can receive tailored treatment sooner, which means better quality of life and more effective management of symptoms. 2, proactive management of complications. AI helps predict and monitor potential complications like scoliosis, allowing for timely interventions and reducing the risk of severe health issues. 3, the advancements driven by AI mean that the SMA community can look forward to new therapies and improved treatments, offering a brighter future. I hope that helps give a clear picture of what it means to live with SMA.
Now, what is one way I could have asked that?
I think you phrased it really well. One small tweak could be to say something like, what are 3 key insights from today's episode that can help the audience better understand individuals with SMA? But honestly, your question was great, and it really helps focus on the audience's understanding. So we're definitely on the right track.
I think today was a very, very good episode. Please let me know if you guys enjoyed today's episode. Wow, I did not know it was 30 minutes video, but it was a good episode. It was completely worth it. If you guys enjoyed today's episode, please like the video. Comment down below what you learned from this episode, what you enjoyed most about today's episode. And let me know if you think I should be incorporating that question towards the end of every episode, where we can talk about how to better understand an SMA individual being of relevance to the discussion within that particular episode. It was a random spark of thought that came to mind, and I thought to try it out, test it out. I didn't quite get the response I was hoping for. I got to play around with that and see how I could better enhance my vocabulary for AI to interpret what it is I am trying to communicate. I love you guys. I appreciate you guys. And subscribe if you are new. I am very, very close to 100 subscribers at the time of this recording. It is currently November 2nd. I'm currently trying to make a few videos because this week's going to be pretty busy. And I am very, very close to 100 subscribers. I currently have 84 subscribers at the time of this recording. And I think it would be really, really cool to reach that milestone of 100 subscribers. So any forms of like, comments, even sharing the video or the YouTube channel with someone you know who has SMA, or even if you just share it across your social media platforms, definitely helps not only me, but definitely helps the SMA community to spread more SMA awareness. I love you guys. I appreciate you guys. And again, as always, remember, grow through what you go through. Much love.